patient 1, their chest tube is bubbling. I'm not real sure what I need to do.
Okay, well, I'm sure it's just fine. Just, is it hooked up and stuff? For sure?
I'm not sure.
I'm sure it'll be just fine. Just make sure it's hooked up, and if there's any more problems, let me know, or we can ask the charge nurse or something.
Are you sure you don't?
Yeah, no, I'm sure it's fine. Okay. I trust you.
Hey.
Hey.
You wanted me to do the assessment in 6?
Yes, let's, how about we go do a couple assessments, we'll go do them together.
Okay.
This is Rochelle. Can I help you?
Hey, Rochelle, Delaney.
Yeah. What's going on? I'm very busy right now, and I'm waiting for Dr. Shaw to call me back, and he hasn't. I've had to put in a few phone calls. What? Can I talk to you later, or when Shaw calls back, let me know. Thanks. Bye. Hey, what's going on?
The chest tube dressing, you
Yeah.
want me to change it, but I don't know where anything is.
Well, have you asked around, or asked another charge nurse or someone to help you? I'm really busy right now. I've got to give this med over here in 12, and I've got to do a glucometer, and so can you just try and get someone to help you, please?
Okay.
Look, you've got everything you need right there. Just set it all up, and if you need help, just give me a holler. I've got to go take care of this patient. Seriously.
You know I've never done one before, right?
It's okay. It comes with a little guide on the. There's an insert. Nobody can get it wrong. Just hook it up and read the guide, and I'll be back. Okay?
Okay.
She's very sweet. Hey, yeah, can you just have Dr. Shaw call me back when he has a chance? Yeah, I'm real busy. I just need him to call me as soon as he can. Okay, thanks. Hey.
Hey, I have a question about the chest tube in 6.
Okay, well, how about I've got some meds to give and a blood sugar to check. Let's go give the meds real quick, and then we can take a look at the wound, and then we can do the blood sugar.
Okay.
But let's go ahead and do it all together, okay?
Thanks. Hi, my blood pressure in 7 is 60/42.
So the blood pressure, we need to know what the base rate was. You don't know. Is fluids going on the patient?
I don't know.
Okay. Did you put the head of the bed down?
I don't know.
Can you look at the baseline trend to see what their rhythm looks like?
I don't know.
What's their heart rate? I mean, is it just that their blood pressure's dropping? What else is going on with this scenario?
I don't know. Hey, the blood pressure in 6 is 60/42.
Ooh, okay. Did you see anything else that might have been going on? Was he maybe, kind of flushed or sweaty or anything? Nothing. Okay, well, that's fine. We can go look at him in a minute.
Okay.
We need to look at his last vital signs, see kind of how his blood pressure's been trending.
Okay.
Do you remember what the last one was by any chance?
I don't remember,
Okay.
but it wasn't something that I actually,
Sure, we can take a look at it. Let's see, was there any family in the room at the time?
There's a couple
of them. Okay, so we can do that. Let's take a look at the last vital signs, kind of take a look at the trend, and then we'll go in there and we'll assess the patient together and maybe see what we can come up with from there. Okay?
Oh, not much. How's your resident doing?
Which one?
The one, I think she's down there in that room 14.
She's doing okay. Lots of questions, though. I don't know where all these questions are coming from.
How far along are they now? I thought they were almost done.
Jeez, I don't know. 6 weeks or something like that. I have to
6
check
weeks.
at that.
They're not almost done.
Do you know what really gets me is they have these patients, and where's their prioritization skills? I haven't really talked to her about it yet, but I would assume she would know. You've got this patient versus that one, who needs to go first? I mean, what are they teaching them in nursing school?
Don't they tell them all that? And don't they give them, some tools to use?
I think so. And the way that, some of these folks talk to other nurses and everything, it's just, I don't know. It's just kind of a mess.
And she has another preceptor coming? I wonder
think
what
so.
she's going to think.
Maybe that preceptor would talk to her, because I don't know. I just don't seem to work well with her, and she's not the type of nurse I would want to be or am, so maybe her next preceptor can talk to her face to face, because I just don't even really want to do that. So, what else is going on?
Not much. I was just curious how your resident was doing.
Yeah, if you want to talk to her, she's in there. I think she's working on a chest tube or something.
Well, Brittany, how is John doing?
He's doing okay. There's definitely some stuff that we could probably work on. I think that he's having a little hard of a time with some time management skills, some organizational skills, you know, that kind of stuff that comes with being a newer nurse.
So having some trouble prioritizing his
Yes.
time.
Yeah, exactly.
Well, why don't we get John to come over here and 3 of us can talk about it, and maybe we can go ahead and look at some of his competencies and see where he's at and get his input.
I think that's a great idea. Yeah, let's do that.
All right.
John, can you come over here and talk to us for just a second?
Okay.
Hey, John, I was talking with Brittany about how you were doing, and she said that you're doing great. How are things going for you?
I get told to do something and I've never done it, and so I'm like, you know, I mean, I would.
Tell me how you see John doing.
I think he's doing really well. I think that prioritization is something that'll probably come with continuing to move along in the residency. And I think it's really important for us to work together.
John, I need you to go in there and check this patient eye, nose, her Foley, her wound, do a little assessment. I've got to go in the other room.
Okay. Hey, I'm John. I'm going to be your nurse today, so if you have any questions, just let me know. So, how much have you had of this today?
Well, I don't know. What do you think, Mom? How much?
Around 150.
Okay, she didn't have another one of these?
No,
This is her first
that's
one?
it,
Oh,
yes.
great. Okay. All right. Okay. Can I check your wound real quick?
So y'all don't have a bathroom downstairs right now?
No, right now with the construction, there's nothing. So that really concerns me when she comes home because she won't be able to make it
Yeah, it doesn't
upstairs.
look like she's going to be able to right now.
No, yeah, well, that needs to be discussed. For
If you can turn it all the way to the side.
Okay.
Okay. A little more, a little more.
All right.
I'm going to pull you back a little bit.
Yeah.
There we go. Okay.
Quartz.
Yeah.
But they spray in. So we're just waiting.
the kids are probably.
Okay. Thank you.
Hey, John, what's the wound look like in there?
Well, it's kind of like white and wet. It's got some yellow in it.
Okay, have you seen the wound before, or is this the first time seeing it?
I haven't checked it before, no.
Okay, does it need a dressing change, or what do you think? Is it deep?
I didn't measure it. I don't know how if it's deep or not.
Okay, it'll probably be okay. If not, we'll get the wound care nurse to come in and look at
Okay.
it.
We're going to go in. It's our first time with this patient, so we're going to be sure to introduce ourselves.
Mhm.
Tell them what we're going to do while we're in there. I'm going to talk you up a little bit because I want them to know who you are
Okay.
and why you're here, okay?
Okay.
All right, excellent. Let's go. Sure hands. Hi, my name is Mary, and I'm going to be one of your nurses today. This is John. John's one of our Versant residents. He's working with me as a new nurse. He is one of several hundred applicants that came to us. We're going to do an assessment today right quick. We're also going to check your wound, and we're going to talk about what you need to get you discharged and get you home.
Into the first, in the first floor. And
How much of this have you drank for the day?
See, we probably need to get like a
I don't know, Mom.
Yeah.
How much you think I had today?
Yeah, around 150.
Okay. This is the first one?
Yes,
Okay,
yes,
okay.
yes, uh-huh.
All right. 150.
Yeah.
All right.
Yeah, I want you to look at this.
Hang on just a second, John. Let's take a look at that in just a minute, okay? Just wrap it up in your glove and put it over here on the sink, okay? Look at it in a minute.
Thank you, ma'am. That's great.
All right.
Ladies, we're gonna check her wound. If y'all wanna come and stand on this side just for a minute,
Yeah,
that'd
we
be
can.
great.
Okay. If you can just kind of turn over to the side, I'm going to check your wound, okay?
Okay.
All right. Thank you.
Is that okay?
A little bit more.
Okay.
Thank you.
Are you having any pain with that?
No, it's okay. It doesn't bother me too much.
Okay. All right. Excellent. Excellent. Okay. Do you guys have any questions for us? Coming out of the room.
All right.
let's talk right quick about a couple of things. What did you notice in there that was unusual?
Unusual?
Mm-hmm.
Well, the wound was, kind of gross and wet.
Right, right. So we probably need to get the wound care nurse consulted
Okay.
to get her to come and look at it. Did you hear her mom talking about the bathroom downstairs doesn't work?
Mhm.
So we can't safely send her home right this minute because there's nowhere for her to go to the bathroom. She can't climb the stairs to the other bathroom.
Okay.
So the best thing to do then is we need to, first of all, the last thing that I was a little concerned about was that bloody tissue. I promised her mom,
Yeah.
yeah, she's young, she wasn't on any oxygen, so she shouldn't be bleeding like that, really.
Mhm.
So we need to ask her a couple of questions, because she had nosebleeds before.
Mhm.
She have a problem. You did a great job.
Thank you.
Excellent. You feel comfortable talking to these folks?
Yeah, I think so.
Yeah, you know what? They're scared. They're in a crisis, and you're their knight in blue armor. Okay?
Okay.
Excellent.
Thank you.
Good job.